Upper gastrointestinal endoscopy is examination of upper GI tract, which includes our food pipe known as esophagus and stomach and duodenum. Upper GI endoscopy is done with a flexible tube which has a camera at its tip, and this sends clear live pictures from inside our GI tract, which can be recorded on our computer and even as video films. So we have a real time examination of our upper GI tract. Upper GI endoscopy is indicated in diseases of esophagus like esophagitis, gastroesophageal reflux disease, gastritis, gastric ulcers, peptic ulcers. It also helps us in diagnosing and ruling out cancers of our food pipe, stomach and duodenum. Upper GI endoscopy helps us in removing foreign bodies, especially coins, pins or dentures from upper GI tract. We can take samples to rule out various diseases like Barrett's esophagus, duodenal carcinomas, gastric cancers, etc. We can also take samples for ruling out Helicobacter pylori infection in our stomach. Many patients come to us with upper gastrointestinal bleeding, and there endoscopically we can stop the bleeding by doing certain therapeutic treatments like hemoclipping or coagulating the source of bleed. Patients who have advanced liver disease often have esophageal varices or gastric varices, and upper GI endoscopy helps us in clipping these varices and applying variceal ligation on them. So upper GI endoscopy can be diagnostic as well as therapeutic. This examination is generally done under conscious sedation for children or for elderly or for people who have comorbid diseases. General anesthesia may be needed. The examination normally lasts for 2 to 3 minutes, but it can be longer in case of therapeutic treatment being given. If you are pregnant, if you are on blood thinners, anticoagulants, you should tell your doctor before undergoing upper GI endoscopy. You will be made to lie on the table, then you will be given a lignocaine spray in your throat so that your throat becomes numb. Intravenous sedation can be given after explaining to you the risks of sedation and procedure. You will be asked to sign a consent which you should understand very well in your own language before signing. Generally, there are no adverse events associated with upper gastrointestinal tract endoscopy. However, at times bleeding and perforation and aspiration are few of the adverse events described. If you have not been given any general anesthesia, you can leave the premises after 1 hour of observation. If biopsies have been taken, then the reports would be available to you after 3 to 4 days.